And this last story has to do with the vaccine, the yellow fever vaccine in Colombia. You may need it. Stay with me now. Just listen. This is going to be a quick one, but this is just the details on who actually needs the yellow fever vaccine before you get into Colombia. It depends on where you're coming from. Colombia requires a yellow fever vaccination certificate for travelers aged 1 year or older arriving from countries with a risk of yellow fever transmission as designated by the World Health Organization. This includes travelers who have transited for more than 12 hours through an airport in these countries. The vaccine must be administered at least 10 days before travel and documented on an international certificate of vaccination and prophylaxis. Based on WHO and CDC guidelines, the following countries are considered to have a risk of yellow fever transmission and would trigger Colombia's vaccination requirement. First, it's Africa with 34 countries. I'm not going to read them all. Chances are you're not from there. Or pass it. But just know, it's 34 African countries. If you need this link, ask me for it. The Americas, though, 12 countries: Argentina, Bolivia, Colombia. Note, if traveling within Colombia, vaccination may still be required for entry into certain areas. Also, Ecuador, French Guiana, Panama, Paraguay, Peru, Suriname, Trinidad and Tobago, on Trinidad only, and lastly, Venezuela. I know personally, I've sat 12 hours easy at the Panama airport. That's just how it happened. So just be aware of this. But here's a few key notes. Exceptions: some countries like Chile and Uruguay are not considered at risk for yellow fever transmission, so prior travel to these countries would not trigger Colombia's vaccination requirement. Transit rule: if you transit through an airport risk country for more than 12 hours, you must provide proof of vaccination. Exemption: children under 1 year and individuals with medical conditions, pregnant or breastfeeding women, or those with certain health conditions may be exempt but should carry a medical waiver from their doctor. The validity: the yellow fever vaccine is considered valid for life, and the ICVP must reflect this. If a traveler's certificate is not yet valid, less than 10 days since vaccination, then they must face quarantine or entry denial. And the sources for this story are the WHO, the CDC, and the U.S. Embassy for health requirements. And they're saying always verify with the Colombian Embassy or consulate for the most current requirements, as entry rules can change due to outbreaks or policy updates.